This is Jack Rickard with EVTV. Our last video that we posted was April 4th of 2020. And a number of you have called, emailed to inquire as to whether I had died from COVID-19 or if I was okay. I'm fine. There's a couple of reasons I haven't done any videos. One, I'm very busy with an exciting new project for a monster 30 kilowatt inverter that Colin and I are working on. Number two, I've got a really bad haircut, but by far and away the biggest reason is that I've had laryngitis, some sort of a thing with my throat. Totally painless, no sore throat, but no voice. In fact, for several days, I couldn't do anything but whisper. Still a very weak voice, and it's gone on for 3 weeks. I have been to see a doctor. He gave me some erythromycin and some steroids and said, try this for a week and we'll see what happens. It's getting better, but I still don't have much of a voice. And so it's kind of a face for radio, a voice for print. And so I've been a little bit out of it on the videos. Just do a short one today. I want to talk about some data I've been playing around with on the coronavirus, kind of from a 30,000 foot look, and see what I can tickle out of that. And I found some surprising things I wanted to share with you. I think it's going to be useful information for you, and quite surprising in that you're not being told this, and it is kind of important on a really wide front. So it's a little thing, but let's take a look at what I've been playing with. Let's take a look at the SARS-CoV-19, or the disease COVID-19 as they refer to it here, from the 30,000 foot level, and see what information we can tickle out of this. I'm using data from the Johns Hopkins University dashboard by the Center of Science and Engineering for COVID-19. And I'm going to extract some of that data. And let's take a look at cases per million by country and population. And I've just entered a few countries here, their population, and their cases of confirmed cases of COVID-19, and sorted on the cases per million. You can see Spain is at the top of the list with 4,547 COVID-19 cases per million population. And Italy is behind that. The U.S. is actually third. We have the most cases of COVID-19 reported in the world, but by population we're number 3 at 3,371. If you look from Spain through Sweden, you all see the descending numbers there. Germany is kind of a special case at the bottom of that European and U.S. flight. And we're going to talk more about that in a few minutes. And then South Korea through Vietnam are all an order of magnitude lower in cases per million. China has 61 cases per million, and 83,959 confirmed cases reported. I hear all day, every day, how China is lying, and they've hidden this data, and I've talked on that before. if you examine the dateline, you can't wedge a conspiracy in there sideways. And if they're lying now on their case reporting, they're doing a fascinatingly poor job of it, as they're right in the middle of the Asian group, with South Korea and Japan having slightly more cases reported, and Thailand, Taiwan, and Vietnam having significantly less. So China does not appear to be an outlier, and this very silly and damaging talk trying to make China the bad guy in the event of an outbreak of a virus is, to me, absurd beyond belief. But in this sortation, we can see China is in the middle of the Asian group, and the Asian group is an order of magnitude lower number of cases than the Europe and US group. Now, there's a possibility that we're talking about two strains of the virus, the Asian strain and the European strain, which brings up a lot of interesting questions. I have a simpler explanation for this, I believe, and Germany is kind of the key to it. That's cases per million. Let's take a look at deaths per million, and we'll sort it on the right hand. I like deaths. I like death in general, but deaths are somewhat more interesting than case reporting. Case reporting is very subject to the level of testing that you do, and so that's kind of a dirty variable, but the deaths are usually more accurately counted. We can tell when somebody's dead. There is some controversy in how you count a COVID death. If you have stage 4 lung cancer and you get COVID-19 and are admitted to the hospital and die of respiratory failure, did you die of COVID-19 or did you die of lung cancer? Similarly, if you chopped your finger off in an industrial accident and went to the hospital and was admitted to have your finger reattached, but you had a serious heart condition and died of a heart attack while you were in there, did you die of a heart attack or did you die of a missing finger? And so there is some controversy in how you count deaths, but we can get more precise numbers and better reporting than we can on cases, confirmed cases, and that's people who've tested positive, but that's very subject to the variable of how many people you test. And just looking at these numbers, I would say that the U.S. has done a pretty good job of testing. I think we've tested more than anybody else, with the possible exception of China, but certainly as a higher percentage of our population being tested even than China. So we can look at deaths, and that kind of provides a counter curve to the test penetration, and so I like deaths. Here we see Spain at 523 deaths per million population. The U.S. is actually 6th at 191.9, and then you have Germany, and Germany appears to be an outlier with 81. And then you get into the Asian populations, and it's absurdly, it's more than an order of magnitude now It's more like 40 times less deaths per million in South Korea and the Asian countries. Now, why would this be? My working theory is that it is the use of masks. Culturally, South Korea, Japan, China, Thailand, Taiwan, and Vietnam have an existing cultural moray in that if you get a common cold, the flu, anything producing a cough or a sneeze, you automatically wear a face mask when you leave your home. Nobody has to mandate this. Nobody has to control it. It's simply how they live. I've been over there and asked about the masks, which I thought were very funny at first, and it was explained to me in a number of places, and it was always the same. It's a courtesy. You can go outside and not infect other people. The Germany is kind of a special case. They're an outlier from Europe, higher than Asia, but lower than the rest of Europe and the U.S. Let's take a look at something here. Germans are Teutonic, of course. They are very much into following the rules, and the rule has been to wear masks. In late April, they upgraded that to a mandatory fine of $5,000 if you're caught out of your home without a mask. And so they have the most severe mandate among all these countries for wearing a mask, and they are probably, out of all the European countries and the U.S., the most likely to follow the law or the advice of the government by nature. And so I think that explains the difference with Germany. But most importantly, it plays in to this mask data, or this comparison, both by deaths and by cases across the various countries on a per capita basis. And so, without a whole lot of other study, I can tell by looking at these numbers the order of magnitude, or in the case of deaths, 40x difference in 40 to 100x difference in deaths per million can be easily explained by the masks. And the German data tends to support that in an extremely odd way. I remain astonished at the extremely poor job our media is doing, and the deceptive job that the Center for Disease Control and the World Health Organization and the United States government is doing. Deborah Birx and Dr. Fauci, I think, are perpetrating a deliberate lie, and that is that masks, first you didn't need them, now you need them, but they're only there to protect others. If you wear a mask, you're protecting other people from getting the disease from you. This is not only untrue, but it's untrue on the face of it, because in the same delivery, they almost always mention that we need to reserve the use of N95 masks for our healthcare professionals, doctors and nurses. Well, if the masks only keep you from infecting others, that would imply their primary concern is to prevent doctors and nurses from infecting COVID patients that have already been admitted with COVID-19. What the hell is that? That's ridiculous. No, why they want masks for doctors and nurses is to protect the healthcare professionals from the COVID-19 patients, of course. And as late as this past week, they were still, the Surgeon General of the United States, Deborah Birx, Dr. Fauci, were all repeating this gross, abject fallacy. The masks protect you. Now, how do they do that? It appears that the primary way of passing a virus from one person through the other is through aerosol droplets in the air. Simply exhaling or speaking, you put out millions of very small droplets, 10 to 20 micrometers in size. And if you cough or sneeze, you project a much larger amount across the room, typically 12 or 15 feet, 9 to 15 feet, something like that. Florida University recently did a study using a robot puffer and glycerol and water and a laser light, and demonstrated the distance and the hang time of these very small aerosol droplets. The N95 mask is called that because it's designed to block at least 95% of all particles larger than 5 micrometers. And that includes 10 to 20 micrometers, of course. The virus, I saw one idiot newsman saying that it attaches to the droplets. One 10 micrometer droplet can contain 1 million freaking coronaviruses. And I don't even know what the number is, but the size scale is immense. So you could put 100,000 or 1 million viruses in one of those droplets. And so, if somebody sneezes and you walk through the area 5 minutes later, you can get those droplets on your face and clothing and so forth. But most importantly, you can breathe them in. If they land on your clothing or something, the droplets tend to dry out, and the lipid-based virus then starts to deteriorate very quickly. But if they're in the droplet, they're safe. And so the mask basically entraps the droplet. In the outer layers of the mask, the moisture evaporates and the virus is left there to die. And you don't breathe it in, or you breathe in a much smaller load of coronaviruses. Yes, of course, it limits the distance you can project a cough as well, but the primary mechanism is that it prevents you from breathing in aerosol droplets from COVID-19 patients. And that's just the way it is. I'm astonished at how this has been misrepresented, and in most cases deliberately misrepresented in our media. Let's talk about lockdowns and economic damage. Does it make a difference? Well, Sweden's done less of it, and they're not even out of the range of the European virus cases. And that's somewhat damning on the U.S. and other countries' big lockdown theory. Yeah, staying at home in theory works, but it doesn't appear to have that big of an effect. In fact, it's several orders of magnitude less effect than simply wearing a mask. And my conclusion is pretty stark. We have committed economic suicide and put the United States into a depression for no other reason than mostly the media thought it would be a good idea without knowing anything about it. But our scientists, which you see constant references in the media, you have to follow your scientists and the data. And this is why I've always been skeptical of scientists and data. And I think it's your obligation in all cases to validate and verify what they're telling you. And in this case, it appears to be a fail. The social distancing and the economic lockdown, I do not think are terribly important. I think it does have an effect, but it's not a particularly big one. And the mask data appears to be abnormal. Like several orders of magnitude greater. If you look at Sweden and the U.S., we appear to be doing a worse job with more lockdown. And that's pretty much true across the board until you get to Germany. And Germany is kind of a special case of a European country that, for some reason, is in the middle. And I think the reason is their religion developed intelligently about the use of face masks. And it's now a $5,000 fine in Germany if you're out of doors or outside of your house in any public transportation and you're not wearing a face mask. There's also kind of a mythology about cloth masks being fine. They're not. The N95 mask is the gold standard, and if you want to wear a cloth mask, I suggest you put on a N95 mask and then put a cloth mask over it. In this way, you can be decorative and and not appear to be taking a face mask away from their healthcare professional. I can tell you personally that if you wear the N95, people think you're a doctor and they will applaud everywhere you go. And through drive-through windows, you get free food. They almost won't let you pay if you're wearing an N95 mask because you must be a nurse or a doctor. So it's kind of a funny situation. In any event, that's my rant on masks and the data where I get this strong bias toward wearing face masks. Again, China's not your enemy. They're not lying. They're not covering up anything. They've done a pretty good job of it. The other thing that I would note about China is they're 2 months ahead of us. And so one of the very interesting things is their economy, they kind of shut down, and they're having a very difficult time starting it back up. They've done an excellent job of alerting the citizens to the dangers of COVID-19. Such a good job that now that they're relaxing the shutdown and allowing restaurants and malls and so forth to operate, they're empty. They're empty a month after they've opened them. China is actually, I couldn't believe this when I heard it, but if you will go into a Chinese restaurant and spend more than 100 RMB at the restaurant, China will instantly, through WeChat on your phone, remit to you from the Chinese government 50% of your dinner bill. In other words, they're paying you to eat at restaurants, and they still can't get people in them. The malls are empty. The factories have been up for well over a month, and none of them have full staffing. People there remain terrified of the virus and very much self-isolating in their homes, and they all wear masks when they go outside. But the restarting the economy is not as easy as saying, okay, ollie ollie out and free, you can all come back out and go back to work. That dog doesn't hunt, and it's not going to hunt in the United States either. They have a large percent of the population persuaded that this virus is very dangerous and that they should stay home. And so I do not expect, with the relaxation in a number of states of regulations closing businesses, that the relaxation of that is going to have a magic effect and everything return to normal. It's not going to. And restaurants and bars and so forth can't operate, they can't stay in business, even though they're open, if they're getting 25 or 50% of their previous traffic. They will simply go bankrupt and close the doors forever. And this applies to cruise lines, and well, it's across the board. And so I see a dire impact to our economy. It's going to be very difficult to restart, and I get that again from China and the struggles they're having convincing their people that it's okay now. And the people know it's not okay, and they're not going out and playing with that. So some observations, and I'll look at sort of global by-country data from 30,000 feet to just get to the bottom line. How many people are getting sick and how many are dying by population, and what are the differences between those countries. And the big difference appears to be right here. Let me pop it up. The face mask. I bought a couple thousand of them, sent them to daughters and sons, and employees families, and some of our friends here in the area. And I think that's your best defense against COVID-19 or the SARS-CoV-2 virus. Now, can you reuse the face mask? Well, obviously, if it's effective, you have coronavirus droplets enmeshed in the outer layer of the mask. The mask is not terribly well constructed. It's designed for brief uses and to sell more masks and to make them cheaply. But they can be reused. I would note that the hand sanitizer that everybody is trying to hoard and get more of is primarily isopropyl alcohol with aloe and or lanolin to keep from drying out your hands. And but it's primarily alcohol, 60 or 70% isopropyl alcohol. Ethanol, whiskey, but 100 proof whiskey would probably work just fine. But isopropyl alcohol has kind of a unique characteristic in that its vapor pressure is very low, and that means it evaporates very readily and in a pure form leaves no residue behind. And so if you want to reuse the mask, thoroughly drench it in isopropyl alcohol and lay it out on the counter. When the alcohol evaporates, you'll have a sterile mask, and the mask won't be damaged by the alcohol at all. So of course you can disinfect the mask easily with isopropyl alcohol. That's what's used in hand sanitizers and so forth primarily. I'm a big Clorox guy, but for the mask, I'd probably prefer the isopropyl alcohol. It is more or less odorless once it's evaporated, and it evaporates very readily because of its low vapor pressure. And so that's the masks can be reused and they can be disinfected. I would like to return to the discussion on testing just a little bit. I'm fascinated by the brothers Cuomo and their ongoing feud on CNN. Chris Cuomo is probably one of the more publicly acknowledged morons on TV. The man is an efficient idiot and faked his own reemergence from coronavirus quarantine and was caught red-handed doing it. But he is an idiot. And he is telling people that the key to reopening the economy is all about testing and tracing. It is absurd on the face of it. You don't have to delve too deep. What happens when you go and get tested for COVID-19? In a perfect world, let's say you could just walk in and for free get a test and get an answer in 5 minutes as to whether you were COVID positive or negative. What do you do if you're COVID positive? You don't have any symptoms, or maybe you do. You could be admitted to the hospital, or I suppose you could go home and self-quarantine. Let's say you test negative. You have tested negative for COVID-19. What does that mean? On the way out from the testing laboratory, on the way to your car, you could be infected with COVID-19. And so you get in the car and drive away, certain that you don't have it, but you actually do have it. The guy that will pass by your car just moments before went in and tested positive. In fact, you've just visited a place where people suspect they have COVID-19. So a negative test is totally meaningless, and a positive test is somewhat vague as to what to do about it. So the testing doesn't do anything. Then there is the absurd notion that we're going to somehow have people from somewhere to take those who test positive and trace down everybody they've been in contact with for the last 14 days and test them. This is an absurd notion. It's not going to happen. Not in the United States. So I want to publicly disclaim that any information you get from Chris Cuomo, even if he has the ever-present Sanjay Gupta sitting there nodding his head yes, is totally worthless information. The man is a fraud and a liar, but it doesn't matter. He doesn't even know. He could accidentally tell the truth without knowing it because he doesn't have any idea of anything he's talking about. But this has been picked up across the country, and particularly in the blue states run by Democrat governors, that the key to reopening is large-scale testing. I don't have anything against testing. I love meters and tests, and I wish I had one right here on my desk where I could stick a finger in and tell if I had COVID. But I don't. And if I did have that information, I'm not sure what good it would do, because I could go downstairs and get infected on the stairway on the way down to the kitchen. And so, literally 2 minutes after testing negative, I could be positive, but very confident that I can't spread the virus because I've tested negative. What the hell kind of test is that? The only test that would have any real value to me is a test for antibodies, antigen tests that show that I'm immune to COVID-19. I could put that on my resume and get a job pretty quick. I don't need a job, and I don't really even have a current resume. But in theory, those who test positive for antigens and indication of immunity from COVID-19, that would be interesting information. Testing whether you have COVID-19 or not now is very nearly useless information. And so what Chris Cuomo, most of the media, and all of the blue state governors are saying is simply nonsense. It's not particularly good nonsense or bad nonsense. It's just totally irrelevant nonsense. They don't know what they're saying, and they don't know why they're saying that, and they haven't done the simplest thought experiment as to what they would do with the information if they had everybody tested twice a day. It's an absurd notion. So don't worry about the testing until we have an antigen test that can determine immunity. That could be useful in a lot of ways. But testing positive or negative for COVID-19 is almost useless. It's not useless if you're going into the hospital and they can use it diagnostically to know what they're treating for. But as a matter of public policy, testing the way Chris Cuomo is talking about it is utter nonsense. I mean, I just sit there and listen, and I can't believe what I'm hearing. And here's Sanjay Gupta bumping his head up and down. Oh yeah, that's right, Chris. Who are these people? This is totally absurd. So if you think the president's going to somehow fix it, which it's the state's job to do the testing, and always has been, but if he could enable them to do all the testing you want, we haven't gained anything. It doesn't move the chess piece forward one square. And so That's my rant on testing.